Kickstart your weight loss journey with Allurion. The Allurion program is a weight loss program centered around a revolutionary gastric balloon that requires no surgery, no endoscopy, and no anesthesia. The Allurion balloon will help you embrace healthier eating habits recommended by a care team that will support you throughout your journey. The program also includes digital tools to help you stay motivated and maintain a healthy lifestyle. People lose an average of 10 to 15% of their body weight in approximately 16 weeks with the Allurion program and maintain up to 95% of the weight lost at 1-year follow-up. The Allurion balloon is placed by a certified healthcare professional during a 15-minute procedure. The balloon is packaged into a capsule that's attached to a thin catheter for easy placement. Your healthcare professional will help you swallow the capsule with a glass of water. Once the balloon is in place, your healthcare professional will take an X-ray to confirm proper placement. Once in the stomach, the vegetarian capsule degrades, and the balloon will be filled with 550 milliliters of water. Then, a second X-ray is taken to ensure filling is complete. The full balloon is roughly the size of a grapefruit. Your healthcare professional will gently remove the catheter from your mouth. The Allurion balloon placement has now finished. Your clinic will set you up with your Allurion app and link it to your Allurion connected scale and health tracker. And you can go home to start your weight loss journey. While in the stomach, the Allurion balloon helps reduce the feeling of hunger by taking up space in the stomach. It creates a feeling of fullness, encouraging smaller portion sizes and helping you to reduce snacking. After approximately 16 weeks, the balloon automatically empties and passes out naturally when you use the toilet. During these 16 weeks, people lose an average of 10 to 15% of their total body weight. You won't be alone as you achieve your weight loss goals. The Allurion program includes ongoing support from your doctor and nutritionist for at least 6 months. They will work with you to change your diet and exercise habits as part of a healthy and holistic approach to losing weight. In addition, you will receive an Allurion connected scale and an Allurion health tracker. Both will be connected to your Allurion app to help track your progress. You will be able to share your successes in real time with your healthcare team. A temporary balloon placement does not mean temporary weight loss. The Allurion program kickstarts sustained lifestyle changes to help you reach your target weight loss and then to keep the weight off. Join the fastest growing weight loss program and start your Allurion journey today.
All right, good morning, everyone. First of all, I'd like to thank everyone for taking the time off this Saturday morning to be with us for an interesting webinar with, as you all know, Lieutenant Colonel Dr. Ahmad Tamizi this morning on the world's first swallowable intragastric balloon. So before we begin the webinar and before Dr. Tamizi begins, I'd just like to give you all an introduction for those who don't know a little bit about our speaker today. So Lieutenant Colonel Dr. Tamizi was actually born in Kelantan. He actually finished off his medical degree from UNIMAS in Sarawak, so University of Malaysia, Sarawak, and graduated in 2006. He then completed his housemanship and medical officership in Kelantan and in the following years as followed. He actually resigned from the Ministry of Health in 2008 before joining the Malaysian Armed Forces as a military medical officer. So between the years of 2008 and 2009, he actually was part of the regimental medical officer for the Bravo Company of the Second Medical Battalion, 5th Division in Sabah, where he served as a medical officer there. He eventually got into the master's program for surgery in University Kebangsaan, Malaysia, and graduated as a surgeon in 2016. Just to add as well for a little bit of his military experience, which was quite amazing. In the years of 2010 and 2011, Dr. Tamizi was actually a military medical doctor and a military observer for an international monitoring team in Mindanao. He was part of a selected 43-man multinational special deployment mission to conflict areas in Mindanao, southern of Philippines, for 13 months during the peace process negotiation between the government of the Republic of Philippines and the Moro Islamic Liberation Front. His expertise there were heavily involved in providing military medical services, humanitarian relief efforts, international conflict management, large-scale international organization administration, and peace negotiations as well. So this was actually quite amazing on what Dr. Tamizi did. After graduating as a surgeon, he was a general surgeon at Hospital Tuanku Mizan from 2017 to 2020. In 2021, he completed his fellowship in upper GI bariatric and metabolic surgery in UKM. So he successfully completed training, observing more than 400 cases of bariatric and metabolic surgery under the guidance of Associate Professor Dr. Nick Reza. And eventually in 2022, he became a consultant general bariatric and metabolic surgeon at Hospital Tuanku Mizan. So without further ado, I would like to welcome Dr. Tamizi this morning. Morning, Dr. Tamizi. I think
good morning. Good morning, everyone, and thank you, Sean, for the
morning, sir.
Hi, everyone. Thank you for joining. I know this is a Saturday morning. Some of us are working, some of us are not. But for those who are joining us, I really appreciate your time spent. Hopefully, we can make this discussion fruitful, gain some knowledge. At least we share what we are doing in managing and fighting obesity as a global pandemic as well. I know the word pandemic has been used until we are really like, we hate the word pandemics right now. But obesity has long been an epidemic. You know, the cause a lot of medical problems. Hold on, I'm trying to share my screen, and today we'll see a bit in one of the treatment that I believe is game changer in managing obesity. So let's start. I don't want to further await you guys. So let's start our discussion. So my name is Dr. Tamizi, as you all know. This is we are talking today about intragastric balloon, one of the modality in fighting obesity. Why globesity? Globesity is not a formal term, but it's coined by WHO to show the level of severity of obesity in the world population. So globesity, what it means is actually obesity is affecting a very large percentage of global population. So it's actually a public health crisis. It doesn't matter you're actually from which country, you know, every country has their own sets of it, and it doesn't really relate with socioeconomics. But of course, by studies, the country with the worst eating habits, and we in Malaysia actually champion that in Southeast Asia. So that's why I think this topic is very important. So obesity, as we all know, as a doctors and practicing medical practitioners, obesity has a lot of medical complications, as you see from the photo on the side, and also it also directly related and closely related to cancer. And as per smoking, controlling your weight actually prevent cancers. So this is a fact. It's not being made up. This is not being made up. Oh my God, sorry. This is not being. Oh no, that's my presentation. Okay, sorry. All right. So okay, for cancers, right? For each 5 kilogram per meter square BMI increasing, you are actually accruing relative risk of getting cancer. And you can see from the upper part here on the left side, it's actually esophageal carcinoma, thyroid, colon, renal, liver. It's actually highly related, and also to obesity in males. In female, endometrial cancer, gallbladder cancer, esophageal carcinoma, renal leukemia. These are all the cancers that high probability to be linked with obesity. And this is a very influential studies by systematic review and meta-analysis. And it is very high quality. So we cannot deny that actually obesity causes cancer as much as smoking causes cancers in certain types, you know, like lung and esophageal CA. But in esophageal CA in obesity is more like adenocarcinoma, likely caused by the reflux because of increased intra-abdominal pressure. Okay, how does obesity cause cancers? These are the theory behind it, why it causes cancers. Okay, this is too theoretical. In clinical scenario, in day-to-day basis, you don't think of this, but it's good to know because it gives you a bit more motivation to treat your patients who are suffering from obesity. Okay, how do we treat obesity? Obesity is a large topic. So myself, as a interventional type of person when dealing with obesity, I still cannot say enough that actually diet and exercise are the mainstay of along the treatment pathway. So diet and exercise, but there are problem with that, diet, diet, some people can follow. Exercise, the obesity population sometimes have problem because some of them have mechanical joint pain. They may have even spinal problems, lower back pain, knee arthritis, ankle arthritis, hip arthritis, and muscle fatigue. They don't have enough energy. Their lung capacity, their effort tolerance is much lower. Sometimes they suffer from comorbidities like hypertension that leads to left ventricular hypertrophy. So there's a lot of limiting factor in exercise. So usually, even we ourselves, when we are dieting, right, when we lose certain weight, we are a bit more motivated to perform some exercise. And this is where we as a medical practitioner should be treating our patients with obesity, either by medications, either by endoscopy, or either by surgery if indicated. So medications, there's exciting future ahead with medications. We have now in the country having medications like GLP-1 analogs. I'll show in a short while. And we have the topic we're discussing today, intragastric balloon, which is one of the modality, which is we are not interfering with any anatomical problems, or we are not interfering with the normal anatomy. But surgery is a different ballgame. Surgery is for patients who are select group of patients where they can actually benefit more. We are not going to dwell into surgery, but I want to ask, are we doing enough for our patients who are suffering from obesity? And you can see from the graph here, this is an old graph, from 2007 from Journal of American Dietetic Association. You see, if you are only recommending exercising to your patients, blaming them for not exercising, or only blaming them for diet. Can you see the first graph on the uppermost? That's diet will do to you in 48 months. How much weight loss? Almost nada. If you do exercise alone, yeah, you will lose some weight, but you are depending on your ability to overcome yourself at certain select time, let's say in the afternoon. Then also there's other factors like weather, like your stress level on the day. But if you are doing diet and exercise, you can see the green line. You see, diet and exercise should be combined together. And this is the part where it becomes a bit difficult to our patients. Like I said before, why dieting alone won't work much. You need to emphasize on the exercise. And combining both are necessary. But for some people to start exercising, their weight is the limit. So how do you overcome this? And this is where we are going to discuss later. So you see the blue meal replacement, it works, but the studies, not so many studies doing meal replacement, because meal replacement, meaning that either you are on some liquid diets, it works. I also perform some of the liquid diets, even to myself, and of course, before I'm recommending to my patients, I would try certain types of dieting to know, how does it feel doing certain diets. And not everyone will be suitable to a single diet. There's a lot of diet. If you're talking about diet alone, it probably takes another 2-3 days in a symposium, probably. And a very low energy diet, which is usually very low calorie diet, it works really well, but then usually not sustainable in long run. And you see here, there's few medications being shown, and the red graph, the red line is Orlistat, Sibutramine, and above the fourth one is advice alone, you see. And you see here, weight loss is not really much. We want to get a significant weight loss. I'll explain why probably balloon is one of the best choice that you have as a non anatomical alteration, And this is pharmacotherapy. This is what I say exciting ahead. As a metabolic surgeons, you want to see you have a lot of tools to help your patients. You see on the left graph, there's a Saxenda. Saxenda is liraglutide GLP-1 analog. It shows promising result, body weight up to 9% in 56 weeks. As we're talking about 1 year here. Meaningful. You see, above is only placebo diet to therapy. You lost about 3% of total body weight. Let's say you're 100 kilo, you lost about 3 kilograms. If you're 100 kilo, you're on a Saxenda, you probably lost up to 9 kilograms. So that's how we put it as simpler. All right, and then okay, Saxenda is available in my practice, my place of practice, but it's not formulary, so patient has to buy it. Cost, it depends. It can range around 800 to 1,500 depending on where you get it. In Mizan, of course, we deal for the best price for our patient. We try to keep it as low as possible as per government hospital recommendation pricing. So we are not taking any advantages for anything. We don't get anything. I just want my patient to get healthy. And for Xenical or Orlistat, you see the numbers are quite also good, but then you may lost about 7 kilograms. Here, they don't show in percent of body weight. Don't be fooled by the number. The graph on Xenical or Orlistat, this medication has been long. I would say that I've tried Xenical myself. The common side effect is you oily sensation near the perianal region. So you're gonna have oil sticking up your ass. All right. This is the latest one. On the right lower part, Wegovy, semaglutide. We have semaglutide in the country, but not in 2.4 milligram dosing. It's in 1 milligram dosing for diabetes patients. But there are encouraging results right now that Wegovy or semaglutide, also another type of GLP-1 analog, showing almost 14% to 15% in body weight loss. So you can lose up to 15 kilograms. That's quite comparable to what we're gonna discuss later. I have no experience in Wegovy. I cannot say much, but these are data that have been published by the manufacturer themselves. So in the country, we don't have Wegovy. So we don't have Wegovy 2.4 milligram, but we do have 1 milligram dose. I don't have it. I think we have in Concomitant, but then I have never used it because it's actually under our medical clinic for patients with diabetes. But Saxenda we do have. Saxenda is the dose is actually for patients of obesity, up to 3 milligrams per day. This is okay. The difference is Saxenda daily injection, like insulin pen, daily injection. Wegovy is once per week. So you see, it's exciting. And semaglutide are coming in tablet forms soon. I don't know how soon it is soon. I was informed we're going to be in Malaysia, it's going to take 1 to 2 years ahead. But I know that in India, they already launched it. So we have an exciting medication pharmacotherapy that we can offer to our patients. All right. So now, okay, I'm going to continue to, okay, intragastric balloon used to be a procedure under bariatric endoscopy. But what we are going to discuss today is rather special. There are only 2 balloons where you so-called procedural. Procedural means you don't require endoscopy beforehand to insert or to remove. You see from there are multiple brands, and there are different time frame for each balloon. Obera, Reshape, Duo, Obera. We have in the country Spatz, which is the number D there, which is endoscopically inserted. Of course, the cost of the balloon is much lower, but you have to pay for extra costs for endoscopy, for inserting and removing. And Spatz stay longer in your stomach, is up to 1 year. And we have Ellipse in the country, which is the player. They come in, I think, if I'm mistaken, last 2 years, 2020, if I'm not mistaken, they came into the country. I've been, for today, we're going to talk more about procedurals, because for me, we keep things simple. All right, keep things simple, and it's less procedure to perform. You are reducing quite a number of risks. When you're putting OGDS or endoscopy, you have to consider the sedation, you have to consider the procedure itself, you have to consider the recovery after the sedation, and you have to do it twice, inserting and removing it. All right, and for proceduralists, you don't require it. It's not mandatory, I will go and delve into that quite a bit. All right. So how much weight loss? Okay, now we're talking, what's the difference here? You see, the percentage here is excess weight loss. So how do you calculate excess weight? Let's say I am 165 centimeter, and my ideal weight would be, by removing the number 1 ahead. So my ideal weight will be 65. That will make my BMI in the range of 24, about 24, 23 to 24.5. So you remove the number 1 ahead. Okay, and then you measure your weight right now. And whatever the weight in excess, that is excess weight. Let's say I'm 80 kilogram. 80 minus 65, I'm an excess of 15 kilogram. You understand that right now, right? There's another way in literature to describe about weight loss. One is excess weight loss in percentage. One is total body weight loss. For most of the intragastric balloon, we're going to go to that in a short while. Okay, you see here, these are the balloons that we saw on the side. This came from a recent meta-analysis published in Obesity Surgery last year. You see how many balloons are there? There's only one double balloon, which is the Reshape Duo, and you put it for 6 months. Mostly are 6 months. Sparks and Obera 365 is for 12 months, and the rest are 6 months mostly. The shortest duration is Ellipse, Allurion technologies. But you can see here, the insertion and removal method, almost all require endoscopic, majority of it. Obalon inserted by oral, but removal by endoscopy. Ellipse is inserted by oral, and then you just pass it out naturally. And the rest are all endoscopic. So as for me, that sounds simple, you know. You just swallow and then you just pass it when it's done. All right. And how much weight loss? How much weight loss for each of these? You can see here the numbers, right? For Reshape Duo, Obera, total body weight loss means, let's say I'm right now 100 kilogram. 7.6% means 7.6 kg. Obera 13 kilogram. If you're 100 kilo, I put up 100 kilogram as a easy number for us to calculate, all right? And you can see the number here: Sparks, N-ball, Heliosphere. All of them are in the range of double digit, you know, between 13 the lowest, up until 14%. The Reshape and Obalon, I don't have in the country, but we have Sparks in the country. We have Ellipse. So you can see here 14 to 20%. But you can see here, Sparks is for 12 months. Ellipse is for 4 months. And you can see the sample size from this systematic review. Ellipse has been inserted in 2,000 samples. Sparks has been 73 samples. And excess weight loss in that duration, it depends, because you cannot take this as per it is, you know, you have to see the references. But I'm showing you that it's really, really promising with the simplest method. So that's why I'm actually really love to share this with you guys. All right. So who are the potential patients? You need to choose, you know, I don't put in all patients, but who are the patients that actually available or can underwent balloon, intragastric balloon. So of course, those people who are overweight and above can put in balloon. Actually, overweight without medical condition, you can still put in balloon, you know, to reduce your weight. But for those who are really strong indication, like morbid obesity, okay, this is the on the right side, number 1 and number 2, morbid obesity without or with metabolic syndrome. You see the number on the BMI is actually different. But this is actually the indication for bariatric surgery. This is not for balloon. This is for bariatric surgery, which is published in our own Malaysian Medical Journal by Mr. Ghaffur et al. They have set the guideline, so how to choose your patients. All right, you can get the paper. It's actually an open access, so everyone can get and then read about it, whether your patients are actually suitable or not for bariatric surgery. But I'm taking this to give you an idea. All right, don't wait until your patient become morbidly obese, more than 37.5. Or if your patients actually have metabolic syndromes, with lower BMI, don't wait until they are actually on high dose of insulin, then only you want to offer. Because metabolic surgery and also balloon and all, it changed life, you know. I have patients who who had severe arthritis cannot really pray, lose their weight, can pray, they can have better quality of life. This is the things that keep me motivated, why I want to help patients with obesity. All right, indication for intragastric balloon, is it for every obese patient? I told you just now that I choose my patient, right? But in general, yes, you should offer for your obese patients. So who is obese? You see here, BMI more than 30. This is actually by WHO standard. In Asian population, we choose slightly lower. It's a big number, but it's not really declared as per classification. WHO put it as an interventional point. It's much lower, but we don't need to discuss that because it's going to cause some confusion. So we keep sticking to WHO classification, but the point of intervention in Asia is a bit lower. All right, to intervene. So like you see here, obese class 1 is 30. WHO recommended for Asian population 27.5 as a cutoff point to start intervening. All right, but the classification remains at obese class 1 at 30. All right. Okay, so next would be, okay, these are the indications for intragastric balloon. This is by one journal has been telling this. I roughly follow this setup. And people ask, Dr. boleh ke saya, or can I put up the balloon? Of course you can. If you have BMI or overweight, is already considered able to put in a balloon. But there are some patients who are not suitable, especially those who had previous gastric surgery or previous bariatric surgery. That's absolutely contraindicated because your size of the stomach doesn't allow the balloon to be inflated. Hyperhernia more than 5 centimeters because the balloon can actually cause you more symptoms of reflux, hyperhernia. So I always screen my patients for reflux. If they have reflux and showing signs of severe reflux, I will probably scope first because I need to treat that first. But if there's no symptom of reflux, I don't really had to scope them before I put in the balloon. All right. Coagulation disorder, those who are bleeding, because this balloon can actually, over long term, cause some pressure, can lead to ulcer. But I have never had any patients with upper GI bleed from the balloon. But if you have predisposed coagulation disorder, I probably won't consider you doing balloon. If you have any bleeding lesion of upper GI tract, this one is only in patients who had previous scopes or you have previous episode of upper GI bleed. All right. If you are pregnant or you intend to pregnant in the next 1 to 4 months, you are not to be put in a balloon. All right. I really want to get pregnant in the next 6 months. So no, if you are on treatment for obesity, on some sort of treatment, either pharmacology or mechanical or surgery, you are not supposed to get pregnant. All right, you are a drug abuser or alcohol abuse because that won't help you. You may get intoxicated because putting in a foreign body in your stomach, actually one of the side effects is nausea and vomiting, but it's only apparent in the first 72 hours. But after that, you are quite okay. Malignancy, if you have strong family history, actually, if you have already malignancy previously, you don't put in balloon in patients already diagnosed with malignancy. And you have severe liver disease, why? Because it can cause coagulation disorder. Relatively contraindicated, previous abdominal surgery. I still put my balloons in patients who had TAPSO because it doesn't interfere with small bowel. You have gastritis, it's okay, you can still put in. Ulcer before duodenal ulcer because it doesn't interfere with the balloon. Hyperhernia, you have mild symptoms suggestive of reflux, not really severe, I probably can still consider to put it in. You are on long-term end state. These are quite regular with my patients, especially those who have arthritis, you know. And for psychiatric illness, I most of the time I will always request my colleague to from psychiatry to actually review patients if there is evidence of psychiatric illness, or you think that patient is actually having some sort of eating disorder. You need to get this sorted out. All right, inflammatory bowel disease you can still put in. Okay, these indications. Okay, this is from the paper by Mr. Gaffo and the rest of the team that come up with the consensus for bariatric and metabolic surgery. This is just an overview. So in case that you guys have patients who are keen on both, you can always refer to me. I will always advise patients what's best for them, depending on their status. All right, so you can get this through the paper. All right, okay, we're gonna go a bit on the second ones. Okay, this one is, I hope, how long already? About 30 minutes. We're going to go for the second one. This is about ellipse allurion, intragastric balloon, the one that I've been practicing. So I have a lot of experience with this balloon. So I want to share this with you guys. All right. So this is what we know about our country. 1 in 2 of our population in the country is either overweight or obese. All right. And this actually translates into the rising cases of non-communicable disease. This is well known, effects among our country. All right. And you see, okay, this one is because visit to the clinic. So for non-communicable disease, it costs a lot. It's not only costing you your health, it's costing you your money, it's costing you your time. So too much thing at cost causing you damages if you are obese. It's not worth being obese. All right. And this is by Allurion. When they survey the market around the world, there are a lot of people who wants to reduce their weight, but limited by a lot of things. So you see the demand for weight reduction. That's why it's flourishing in the country, slimming pill of unknown origin. All right. And some people make money and millionaires became millionaires because selling slimming pills of unknown origin. So we doctors, we hate something of unknown origin, right? So we really hate that. So why don't we are the one who's supposed to help our patients? We should be offering them. And I have a tagline. Kurus itu mahal. Kurus itu mahal because you spend time, you spend your effort, and sometimes it involves money, to reduce your weight. So you need to spend. You need to spend either time, either efforts, either money to reduce your weight. And it pays handsomely. You live life better. And are they frustrated by their effort to lose weight? Yeah, because I've been practicing metabolic surgery, and I've seen a lot of patients where they have tried dieting and exercise, and they're not doing it once, they're not doing it twice, they're trying multiple times. And you know why they fail? The only reason you fail is because you're only relying on your free will. And your free will fluctuates. Dalam ajaran Islam pun bagi tahu kan, iman tu ada naik, ada turun. It fluctuates. So same goes with your ability to control food intake. Alright? Ni esok puasa kan, tapi semalam dah ada majlis makan-makan menyambut puasa. And probably pagi, tengah hari, malam pun ada. And last night I think probably a lot of people going out because nak celebrate makan malam sebelum bulan puasa. And last night we can actually dine beyond 12 a.m., which is interesting. Now we're going to see it rising again, our weight in the country. So 1 in 2 in Malaysia are overweight. And you see how many requires intervention. This is global interest in intervention, and 60% would consider balloon. But the limiting factor is actually fear of complication. This is quite a popular question. Doctor, apa side effect? Apa side effect? Doctor, what can happen to me after the balloon? Will it stuck? Will it explode in my stomach? Would it stuck in my small bowel? It will not explode for sure. It can deflate early, but then there's a lot of reason for it, and the rate of that is very, very low. But the company comes with guarantee. You see how confident they are with the product. They come with guarantees. And risk of damage. Okay, you see, some patients, if you offer them to put in a balloon with OGDS or endoscopy, that's also rejected. So swallowing a pill sounds tempting, right? And balloon considerations. Some people, and one of my strong indication why I practice putting in balloon. Some people doesn't want surgery, irregardless of their BMI. They just scared. So balloon will be a good option to lose weight. Of course, you won't get the number if you have BMI of 40, but you reduce weight. And with each weight loss, there's a lot of benefit. 1 kg weight loss equal to 1 millimeter mercury of blood pressure come down. All right, so that's how good it is. Okay, so this is again why procedureless balloon is good because some majority would love to have this intervention. All right. Okay. For weight loss, what are the side effects? One is weight loss. Number two, considering treatment for facial body concern, weight loss is always the top. That's why there's a lot of products in the market of unknown origin claiming to be slimming pill, makan seminggu turun 20 kilo. And the problem is that we are gullible, all right? And we as a medical practitioner should advise our patients. All right, so what comes with Allurion program? Allurion program is a very short procedure. I can guarantee you the shortest duration that I inserted is about 10 minutes. About 10 to 50 minutes. The longest is no more than half an hour. All right. You lose how much you can lose? Up to 10 to 15%. This is the most extensively studied gastric balloon in the world, right? And they have the data of 10 to 15%. The balloon is, as you see from the promotional video just now, more than 50,000 by June 2021. And by now, I think, correct me if I'm wrong, more than 80,000 balloons all over the world. So you have a good safety profile with this balloon. And they have their own app, which is connected to a tracker, to a weight scale. And the good thing is you can share that with me as I'm your whoever that you've been to, your doctor. You can share with them the data, and we can intervene much earlier when we see something is wrong or stagnant. All right. And the Allurion program doesn't come only with tools; it comes with team support. They have clinical nutritionists. They have a good team to monitor you up to 1 year until after insertion of the balloon. So you take 4 months of the balloon in your stomach, plus another 8 months of support. You don't have that kind of personalized approach, and access to certain programs. All right, and this balloon is one of the most popular balloons in the world. You see, how does it look like, the balloon? All right. So this is a balloon. What is the composition of it? You get a balloon film. It's flexible. It's very durable. Don't worry about it getting punctured. How does the balloon work? It is you swallow it, and then they are filling. Once they fill the balloon with the fluids, and then you have a release valve. This valve is this is the one that weakens over time, and then after certain time will cause the balloon to deflate, and then this whole film will be expressed or will be expelled naturally by bowel opening, And see, the balloon film is very thin, it's very durable. This is, by the way, as far as I was informed, this is like the fourth generation. Why fourth generation? Because they keep improving with each complaint, even though the slightest complaint. You see, some people ask me, Doctor, does this balloon cause intestinal obstruction? Only in the initial first generation of the balloon, there were reported cases of intestinal obstruction. But that one, after the second generation onwards, there's no more cases like that. All right, and that's why we have patients with previous laparotomy, small bowel resection, and gastric resection, we don't is contraindicated for the surgery. You swallow it. We're going to go to the video later. This is an interesting video. It's one of my patients. And then you fill up through the valve, and then after I pull it out, it seals itself. And then there's a release valve. So it weakens over time. The opens at predetermined time. As far as the studies goes, it's 120 days. Anything before that will be dealt with. There's a guarantee from the company how they're going to deal with that. And it stays in your stomach for 16 weeks, 4 months, roughly. How do I do it? I'll show you later. So this is how I confirm actually the balloon is already in it. Can you see that clearly? The markers and all. So once the balloon is in, I'll inflate the balloon. We'll see the video in a short while. All right. 10 to 15% weight loss. Very short duration of procedure. No anesthesia. You don't even have to have or be on sedation. There's no procedure. You only need to swallow it. Albeit the capsule is a bit large, but I can say most patients are able to swallow it. I think almost all patients can swallow. If they can't, there's a way to do it. We use a stylet to push it in, but that's a moment of discomfort. But then, other than that, it's okay. All right. You see, there are also nowadays sequential balloon. You put in a balloon, you rise, you put in another balloon. All right. And this already been published. I have not myself experienced putting in. No, I have only one patient who put a second balloon. Still ongoing. We will see how it goes from there. But studies shown the result is very encouraging. Almost nearing a bariatric surgery weight loss without any surgery. You understand now? So it is promising. But probably one of the it's not for everyone, but then it gives us extra tools. So now I know I can put a second balloon if the patient is interested safely. All right. Weight loss curve. Why the balloon is only 4 months? Because studies shown that most of your weight loss come within the first 3 months in any balloons. All right. So that's why you put up the balloon up to 4 months is enough. That's what the arguments are from the manufacturer. All right. So these are the cases: adverse events, premature deflation. It's all less. That means out of all 80,000, probably out of 30,000, 2%, less than 2%. What happens is premature deflation. You won't feel the stomach, the balloon in your stomach. You can feel it actually. Some patients can actually palpate the balloon is really in your stomach. And premature deflation is dealt with by the company. Usually it depends on how many days it deflates. Intolerance means some patients had nausea and vomiting because it's a foreign body in your stomach that cannot be expelled. So some patients had very bad nausea and vomiting, especially those who have GERD. So that's why I always screen my patients. That's why I choose my patients. Small bowel obstruction, this is the initial phase, now no more, less than 0.09%. That means 9 cases in every 10,000. Insertion. And hyperinflation. Hyperinflation means it costs you a bit more symptoms. The balloon can actually inflate a bit more than the intended 550 ml size. So it can be a bit higher. All right. Okay, so this is the studies but there are a lot of studies, so you can actually go and have a look at it. Heavily studied, the one that most popular is the one that on the first layer there, where they perform on 1,770, and followed by that they put up systematic review and meta-analysis. So total body weight loss of about 14%. So if you're 100 kilo, you can reach up to 14. We have patients who lost up to 20 kilograms. All right, sequential balloon, still in studies, a lot of studies, but it's been shown to be safe. And yeah, so these are the team. I think some of you already had the balloon. If you have, these are the teams from the company. They are very supportive. These are basically the persons that been helping me to monitor the patients, to a lot of addressing, because you can't do this alone. I can tell you that I can't do this alone. You have to have a team. All right. And they have been doing this once you are committed to the program. All right. So this is how they do it. Introduce, I will screen the patients and all. And then before placement, I will tell the patients. Sometimes I do phone consultation, I do video call consultations with patients, and then we place it. And then post placement, you'll be, after the placement, you'll be observed for about 1 to 2 hours. If you're okay, you get back home. And they will introduce you to their app, very comprehensive app. And then you have insights, So basically, this is a very, metric and a calculated way to lose your weight. It's nothing like it. I can guarantee you that. All right. And okay, I'll show you the video how I inserted the video. Sorry. That's my bad. Sorry, we'll do it again. Yeah? Yeah, I think you see how simple is that? So I think I'll end that with that video. I think that's above all show the simplicity of the procedure and why I like it so much in helping my select group of patients with obesity. Yeah, I think that would be all, Sean. I've written back to you and probably for some questions.
All right, thank you, Dr. Tamizi, for an amazing presentation. So I'll leave it open to the floor now to everyone present if they would actually like to ask any questions or anything you're not too sure of, or whatever questions you may have, and Dr. Tamizi may be able to answer. So if anyone would either like to message it in the group chat, we can actually pass it on to Dr. Tamizi, or if you want to unmute yourself and ask a question, you all can do so as well. All right. All right, I think we've got one question, Dr. Tamizi. This is from Muhammad Shazwi. So first part is, does patient on the intragastric balloon or off need to start on any other weight loss medications? And the second part is, how long do we use this intragastric balloon before going for other invasive surgical intervention?
Okay, patients on the does the patient on intravenous on or need to be on medication? Usually, if you're on the balloon, you don't require any other medications. But there are patients that I have has been on Saxenda as well while on the balloon, and there's limited data on that being published. But I can, from my experience with that patient, this is by my limited experience, yeah. The weight loss is actually more if you are on medication and on balloon, but the catch here is that your side effect will be more. There will be a lot more nausea and vomiting because the drug itself can induce nausea and vomiting. The balloon also can cause nausea and vomiting. So you have double, the side effects. So, my patient is apparently able to tolerate that very well. So she lost a bit more, extra another 6 to 8 kilo with medications. So how long do we need to use the balloon before going for another invasive? The balloon will be there for 4 months, and then after that you rest for two months, and then you can put another balloon. So if you want to use medication at this moment, you can actually start during the balloon or after the balloon. And you mean if others invasive surgery? Okay, there are also patients where BMI is very, very large, high BMI, super obese patient, BMI of 50. So making the risk of surgery is higher. Some patients can, and balloon has been used for, they call it bridging therapy. You lose at least 15 to 20 kilo before the surgery itself. This is a good option for patients where you're trying to reduce the overall risk for surgery. So that's also has been done before.
All right, thanks, Tamizi. The next question is from Dr. Nurashia. She was asking, how much is the total procedure?
Okay, the total procedure has been, because you must remember, the procedure, the balloon itself, cost of the balloon itself, roughly, I think it's about 12,800. And then, but there are also hospital charges, medication charges, because this procedure require charges of all. And most of the hospital that performing it, I think in government setting, not many. There are also, I've been doing in Mizan. In Mizan, the cost with some medication, because some medication I don't have, you really had to buy it. So that will push your costs somewhere in the range of at least minimum of 40, about that, plus with the drinks and all that you require to, because once you put in the balloon, there are set of diet initially to follow. You cannot simply take the balloon and then you pergi makan nasi biryani after that. That doesn't work that way. You have to be on some sets of guided nutrition. So during that point, there are some expenses, you need to buy of certain liquids and all. So that will be the option. So it can I usually quote my patients somewhere around 14 to 17, depending on where you do it.
All right, thanks, Dr. Tamizi. The next one is from Dr. Liana, actually. Say I have a few obese candidates. How do I go about referring the patient?
Yeah, okay. Okay. You can actually, if you are on, if you have my Instagram link, just DM me. If you have my phone, I believe everyone that's enter here, some of them, most of them, majority have my phone number. Just contact me directly. I'll arrange for patients to be seen in my clinic. What I need from the details usually are their names, their IC, their phone number, their weight, their height, and their BMI. And if you have a bit of comorbid, just let me know. So that will at least give me an idea, and then I'll screen your patients. You can contact me. I can be contacted through email, through Instagram. My Instagram is Dr. Tarmizi. I have also a TikTok account, but then I rarely reply on TikTok because TikTok is quite overwhelming sometimes. There's the overwhelming because there's so much questions there. I can't possibly answer everything in TikTok because it's just too wide. So on my Instagram, you can contact me directly through my phone as well. And my email is drtarmizi.muhammad@gmail.com. And also you can contact my clinic in Tuanku Mizan.
And just to add to that, Dr. Tarmizi, I think I spoke to you about this. So for GPs who work, I mean,
so kita kurang.
Yeah, so we'll actually put up our number there as well since we work with you. But just to add to Dr. Liana's questions as well. So for GPs who work with a bariatric surgeon, we can explain more about a referral program that we're actually working on, which I spoke to you about. So for every patient they refer to you who have a successful placement, they get a referral fee, but I'll be able to explain more to the doctors who are interested in asking more about that after the webinar.
Where can they go? Where can they go, Sean? They go to your website, Kita Kurang, or how is it?
Yes, so we will blast our Kita Kurang at the end of the webinar, so they can actually contact us as well, and then we'll contact them, and then I'll liaise with you. But then, or they can contact you as well. So both ways work well with me.
All right. Those anyone who wants to ask directly, you can unmute. I think. Yeah, is that okay? Okay.
Yeah, that's fine. Anyone wants to ask more questions?
Or just type. Can ask. I think I should stop sharing my screen already. Yeah.
So no more questions from anyone else? All right. Okay, Tamizi, I think there's not any more questions from the floor. Okay. So yeah, so I would actually like to thank everyone for taking the time off this morning to actually come and be present for this amazing webinar. I would actually like to thank Dr. Tarmizi for taking his time in explaining and giving a good presentation. So like I said, feel free to ask him more questions privately if you all want. And as you can see there as well, that is our support group, Kita Kurang. So for any doctors or healthcare providers who would like to ask us questions as well, you can just contact us directly and our team will get in touch with you all and explain more about how the referral fee works, how the whole referral program works for patients who have the program with Dr. Tarmizi. So thank you again, everyone, for attending. And Dr. Tarmizi, thank you so much this morning again.
I would like to add, I think we reached maximum capacity. It's only 100 allowed. I've been receiving a lot of WhatsApp. People cannot come in. But then you guys can actually spread this. This is a recorded session, right? And then later I'll send over the link. It's going to be published so that everyone can benefit. You can share this as well. I would really appreciate, because we should spread this awareness about non-invasive procedure, which is really giving the push that our patients need when managing their obesity. And I really thank you guys for joining us today.
All right, thank you so much, everyone, and hope you have a good weekend. Thank you.